Hey, Andrew. So the main concerns with this new variant are the number of mutations on the spike protein, more than 30 identified there, some of which could potentially be associated with increased transmissibility, others potentially with the ability to evade vaccine protection. Now, I was speaking with Moderna CEO Stéphane Bancel this morning about how quickly they could ramp up a new vaccine construct potentially here. He noted they've been able to do this before within 60 days. He said the question of the timing there is the regulatory process from that point. Can you use antibody data to clear a new variant vaccine, or do you need to run more studies and wait perhaps 2 months there? He said the manufacturing then on top of that would take a couple months, but the companies can do this really quickly. We are also hearing this morning from BioNTech telling us they expect within 2 weeks to get laboratory test results on how well antibodies neutralize this variant. They say that Pfizer and BioNTech have been able to adapt the vaccine within 6 weeks and ship initial batches within 100 days in the event of an escape variant. So they've begun clinical trials with other variant-specific vaccines to Alpha and Delta to collect safety and tolerability data. So all of that will be able to play into this. Guys, what we're showing you right now is some data from South African researchers. We were just showing the little blue section there is how quickly this variant has grown in prevalence in South Africa, looking like it could potentially compete against Delta. But what's really important to remember is that this is just very early days. There are not many cases of this yet, although they are increasing quickly. South Africa is worried about a potential fourth wave from this. Other countries, of course, worried about it as well. Guys?
In terms of therapeutics, obviously we have this Pfizer drug on its way, the Merck drug. We have some new news about it being a little bit less efficacious, if you will, than originally expected. Do we think that those therapeutics would work against this new strain?
The expectation is that they should. The antiviral drugs, Pfizer's is thought to be a pan-coronavirus drug, so it could work against different coronaviruses, not just different variants of this coronavirus. We haven't heard from them yet this morning about that, and of course it will take time to definitively say things like that. Merck's as well, molnupiravir, is very broadly acting, so the expectation is it shouldn't be daunted by mutations like this, but we will need to see the data to say that with more certainty. But those drugs shouldn't be affected. It's the antibody drugs potentially that folks are worried about, specifically Regeneron's and Eli Lilly's. There is some thought that perhaps Vir Biotechnologies and AstraZeneca's could hold up better against this variant because of the way the antibodies are constructed to target the spike protein. But of course, we'll be waiting for lab data on that as well.